Yes, how are you? Hope you all are doing good. After a long time, I came with one interesting topic. It for me it's very interesting. If you are a research scholar or if you are doing your UG or PG, if you are studying a research, this word will be in your mind always. Understand? So when I am doing my UG, this is not very familiar or very relevant to everyone. When I into a PG by a time, my mentor or my beloved principal madam, every time she used to tell like this word. Understand? Even though she is taking a simple medical and surgical class, also she will be telling or from the beginning or middle of the class or at the last of the topic, she will be mentioning this word. So that will be make me to or make me to know about how it is, what it is, why it is like that, and that spark made me to or inspired me to study this topic. Understand? And so during my PGs also, I'm not very fond of this word, and because it is very, as a student, it's very boring topic, as you know already. It's very boring. But when I was in a second year of my PG during my thesis, so my principal madam, made me to know the value of this word in my thesis. Understand? So she made me to know what is that, how it is that, and what is the outcome, and how it is very important in nursing. So, in and out, she made me to know about this topic. I am very grateful to her. I am very blessed to be a student of her. Understand? Because this word, till now, it will not arise from my mind. Even though if I am taking a single step in my career or in my life, this is make us a benchmark. Okay, so today we are going to see about the evidence based practice in nursing, why it is needed. So in the name evidence itself, you came to know evidence means there is a proven one. So based on the proven one, we are going to practice, that we call it as a evidence based practice. So theoretically, we are having something in our hand. It shows, it gives the principles or steps of the procedure, or what is the indication and what is the contraindications, what is the remarks of the particular steps in a procedure, like that. Understand? So theoretically, we know about that. If we take a disease condition, theoretically we know what is the pathophysiology, what is the sequence, and each step of a pathophysiology, the disease, how it is occurred. So that is a theoretically proven one. When you come to the practice, we have studied that. When you come to the practice, we are going to prove the scientifically evident practice. Scientifically evident or proven practice, we are going to tell to the world that this kind of a practice will be relieve this kind of a symptoms of the patient. So this kind of a practice will be helps to improve the life status of the patient. This kind of a practice will be improve the nursing skills of nurses. This kind of a practice which helps to make a nurse to expertise in their nursing field. So it will be proven with the help of a scientific evidence. Scientific evidence. The knowledge as well as the scientific evidence which helps to, based on that, we are going to practice or we are going to give a care to the patient. So when you come to the definitions, evidence-based practice, it is a scientifically generated knowledge with knowledge expert practitioner. If you consider, excuse me, consider me as a practitioner. I have published one kind of a practice or one kind of a scientific proven practice. Take as example, the patient with post-mastectomy. The patient, one of the complication is lymphedema. So I have proven that the lymphedema will be relieved by the arm massage. If you give a arm massage, the lymphedema will be relieved. So that is a scientifically proven one. So if I am going to tell to the nursing people or nursing world that if you have a patient in your ward with a mastectomy, post mastectomy, you educate them or you give a arm massage to your patient, the lymphedema will be relieved. So how I am telling strongly to the nursing world, because I have a scientifically proven knowledge. So the definition says that the scientifically generated evidence with the knowledge of expertised practitioner. Understand? So evidence-based nursing means it, with the help of the scientifically proven evident knowledge, make nurses to provide or made a kind of a clinical decision with best available research evidence. So which evident is so many kind of a relevant information for lymphedema to relieve the patient from lymphedema after the post mastectomy. As a nurse, I have to pick among that which is the most evident practice which is help my patient to relieve from the lymphedema. So it is the nursing knowledge or nursing experience which is improve the efficient care towards the patient with the help of the best availability of a nursing proven care. Understand? Okay. So why it's needed? Why the evidence-based practice is needed? It helps to update our knowledge in the lifelong learning period. If you take nursing, it is endless. Every day we are having a different concepts. Understand? So if you see the Asian nursing, they doesn't know about the forensic nursing, they doesn't know about the robotic nursing, they doesn't know about the space nursing. So nowadays we are in that world. We are in using of AI technology, and then we are using all other technology which helps to improve the well-being of the patient. Understand? So it is a knowledge, it is very essential for the nurse to the lifetime learning process. And then it is a provider clinical judgment. When you come to the clinical judgment, if you take an example of a pain, the patient is having a kind of a pain. If you give the pharmacological therapy also, the patient cannot be subside with the pain. So, and to switch on to the non-pharmacological. So when you come to the non-pharmacological, we are having so many varieties of non-pharmacological availability. So as a nurse, I have to have the knowledge which has the specific or appropriate for my patient to relieve the pain. So it should be based on the clinical and scientific evident one, proven one. This kind of a non-pharmacological therapy which helps to relieve the pain of a patient. So it made me to provide a clinical judgment towards the patient care. And the next one is improvement of care provider. So we are not practicing as like how we are practiced in the ancient times. Understand? So we are before we are giving a sponge bath to a patient, we are placing a mitten, and then we have with the hot and cold water we have to use so many mitten cloths for a head, for a face, for a armpit, for a arms and the trunks, like that. Nowadays we are not using that kind of a mittens. We are using according to the scientific proven one, we are using different way of method of sequences, understand. So see, products for giving the bath or anything. So likewise it is the improvement of a care provider. So likewise we are not using the same thing which is available in the ancient time. We are improve the to accommodate the technological improvement of the patient, understand. Provide the framework for understanding of evidence-based practice. Framework means, so if you come to the evidence-based practice, it is gives you the steps of the work or blueprint of your care. You have to start from this step to, you have to, the result has to become. If you started with this step and if you follow this kind of a step, the result will be like that, like kind of a framework you can see in the evidence-based practice. So it gives us the framework, it gives us the very easiest way. In this easiest step, all the step is clinically proven and scientifically proven steps. So at last it is helps you to give a particular type of efficient care to your patient. Okay, this is the need for evidence-based practice. Next one is purpose. So when you come to the purpose, the evidence-based practice, it is replace the practice as usual. So usually we are giving the care like that, and nowadays every day we are having a each kind of a proven thing in order to improve the status of the patient, understand. So one time we are using this kind of a care to the patient to relieve the pressure injury or to relieve the pain or to relieve the like that, and the next time there is one eruption of a proven knowledge, it states that this knowledge or this proven one is improvised one from the previous, like that. Okay, so it is replace the practice as usual. We are into a newer thing which is based on the nowadays, and make the practice in a less subjective to a higher accountability. So we can see visibly, we can see the outcome of the patient, and then we can see the outcome of the efficient care of a nursing personnel, and then reduce the variation in nursing care. When you come to the nursing care, if you are in the same university, under the same university, each colleges has a different steps in the care, understand. So if you are studied in one college and then other one is studied in another college, if you come up together in same institution, you are having a conflict, this step comes under that step only. The step has to be like that only. So you might have having a conflict, understand. So when you come using this evidence-based practice, there is no variation in a nursing care, because it shows you where you have to start, where you have to stop, when you have to stop, and then which kind of steps you have to follow to achieve that goal. So there is no variation in a nursing care. From the top to the bottom, all the nurses, if you are pick that kind of evident care, you must to follow this kind of a step to improve the status of the patient, understand, and to deliver the effective nursing care. Deliver the effective nursing care. How come? So nowadays we are running in a instant world. All are instant. Like heart surgery previously, in the ICU itself, if the person is underwent a bypass surgery, coronary artery bypass surgery. The patient will be there until 15 days. After removal of cave wire itself, the patient is in the ICU only. Nowadays, only 12 hours or 24 hours the patient is staying in the ICU. After that, the patient is come out of the ICU. The stay of the hospital is very minimal. Why? How? It is a scientifically evident proof or evident practice. It make us a nurse to competent with the technological improvement. We are also improving our knowledge to competent with the technological improvement. So we can able to provide a effective care which is related to the improvised world. Understand? So we are not practicing here as same like before. We are also improve the style of practice, the skills of practice is improved on the basis of a scientifically proven topics or scientifically proven care. So that it will be, we can also deliver a effective care or efficient care to the patient. Next we move on to the goals of evidence-based practice. So when you come to the goals, it is evidence-based practice is delivers a effective of care, nursing care, and then it can resolve the problems in the clinical settings, and it achieve the excellence nursing care delivery to the patient, and it relieve the variation in a nursing care with effective decision making about the patient care. So this is the goals of the evidence-based practice. So next we move on to the steps. Okay. So when you come to the steps, the first step is ask. Ask means questioning. Okay. So frame the focused question which is answered by a evident review. Okay. The question should be answerable. All the questions which is arised by us, it should be gives you a evident answer. Understand? The next one is acquire. Acquire, identify the source and collect the potentially relevant studies. Okay. So we arise one kind of a question, and then we have to acquire a relevant knowledge or relevant items or relevant practice which is available to the particular question. Okay. And then apprise. Apprise means it is create an evidence based by the applying screening criteria related to the topic, questions, practices and outcome. So how we have to apprise? We are apprising the evidence based by screening, and then which the criteria which is related to questioning, practicing and outcome. So what kind of a question? From the question we are find out the relevant outcomes or relevant steps, and then we are practicing that one. With the help of the practice, the outcome, how it will be. Understand? That we call it as a appraisals. Okay. The next is analyze. Analyze means standardized method, or we are summarizing the data which is outcome from our practice, and we can able to rate the strength and weakness of it, of the particular evidence. The next one is apply. Disseminate the findings for review and the local publications. And then next one is audit and assess. So in the audit and assess, so we have formulate a question, we acquire the knowledge, we apprise it, and then we have analyze it on that, and we have to apply the particular analysis items, and we are going to audit or assess. So whether all the questions which is formulated, whether it is achieved their findings or not, or the findings which is related to or relevant to the questions what we are arises, or it is a scientifically proven one or not, that we are going to assess or analysis. So this is the steps in evidence-based practice. What is the step? The first one is ask, that is a focused framed questions. So which is answered by the evident relevance. Next one is acquire, identify and resources and collect the relevant or potential relevant studies which is accomplish the particular questions. Next one is apprise. It is create the evidence base of a screening, buyer, questioning, practicing and outcomes. And then we are analyzing and summarizing, check the rate, the strength and weakness of it. And then we are apply or disseminate the findings for the local applications or for the reviews. And then we are assess and audit. This is the steps of the evidence-based practice. So when you come to the framing the question, the Salkett et al. In the year of 1997, they are formulate one kind of a frame that we call it as a Pikov frame. Pikov frame is nothing but that is a population or a problem, intervention, comparison of the interventions and outcome framework. So that we call it as a Pikov framework. So once they are the Salkett and et al. And their subordinates, they are using this kind of a frame. So it is basically based on the skills and knowledge and the scientific manner which is apt to the particular persons to arise the questions. Understand? In that first element is population or a problem. So in the population or a problem, as a practitioner, as a clinical expertise, so we have to necessary to specify the age, gender, disease and disease comorbidity, and then disease severity and type of a disease. So that kind of a questions, so we have to formulate. So define who and what is about. So what kind of a question we are framing and what is about and why it is about. So this is, we call it as a problem or a population. So it has to be inclusive one. And then with that we have to apply a framer questions which is relevant to the specific variables which is inside. Understand? The next one is intervention. The define which kind of interventions we are going to expose or we are going to experience in a plan of course or plan of action, and then we have to describe the clarity of the outcome. So intervention means which kind of interventions we are going to use for the each step of a procedure, and then we have to provide a clarity and which kind of outcome it will come for the patient care. So describe what is you considering and what that has happened to the patient. Means if I am going to give a heart application, I am taking the heart application as an intervention for the pain. I am taking adult, this age group, not an open wound or only a swelling. If I am giving a heart application, it will be relieve the pain and it will be subside the edema of the person. So that has to be described properly. Describe what it is you are considering. I am considering that the edema will be subside, and what that has to be happen to the patient. The patient is relieved from the pain and the edema is subside. So this, according to the Salkett et al., the intervention must be like that. It will be clear-cut idea. So this is I am going to do. This will be going to happen to the patient like that. Understand? So this is the intervention in the Pikov frame. Okay. Next in the Pikov form, is comparison intervention. So comparison intervention is we are came with the alternative intervention. So as a clinical expertise, we have to compare the both interventions, the normal intervention as the alternative interventions. We have to pick up with the best interventions for the patient. So that is the comparison of intervention. The next is outcome. So general outcome, it is very difficult to measurable, understand. So we have to give a specific outcome or the measurable outcome from the help of this picoframe. So here, if that is objectable, measurable, need to be specified. So if you give this will be happen. That is a specific measurable thing, understand. So with the help of the picoframe, we can find the specifically outcome and measurable outcome. So this is the picoframe. Picoframe is population, intervention, comparison of interventions and outcomes. Next we move on to the evidence. So when you come to the sources of evidence, that is the filter evidence, unfiltered evidence, clinical experience, knowledge from the patient, knowledge from the local context. So filtered resources. Filtered resources means is based on us, understand. So it is a clinical expertise which we are having a knowledge, and then we are having a evidence synthesized questions or evidence synthesized knowledge or practice we are having. So this evidence, it is based on the research practice now, is based on the research. We are formulating one kind of a resource towards the patient care. So it is basically based on the research. So that we call it as a filtered resources. Unfiltered resources is, it is most recent information. So maybe you can Google it with the Medline and then Chinhal etc. You can able to find out everything. That is the most unfiltered resources. Next is a clinical experience. So clinical experience, it is truly based on the knowledge of professional practice and experience of one person owns, and then it is based the practice as well as the experience. It is a provide a evidence based nursing care of a patient. Okay, and then it has to be a person-centered care based on the knowledge and based on the experience of a person, and the knowledge from the patient. If the evidence which is delivered from the patient and their social living and well-being, or from the thoughts and from the social well-being of a person's, the evidence is delivered by the person, that also kind of a sources. Next is the knowledge from the local context. It is due to a audit and due to the some social and professional networks, we are also came to know the kind of a resources availability. So when you come to the sources of evidence, filtered resources, unfiltered resources, clinical experiences, and then knowledge from the patient, knowledge from the context. So when you come to the models, models means the based on this only we are doing the practice. So we are having so many models. Mainly in this class we are going to see only 3 models. That is a stellar model, lava model, and then rose swarm and lava bean model. So mainly basically these 3 models we are going to see in this class. The first model is stellar model. So the stellar model, we call it as a practitioner oriented model. It is formulated and practiced by in the year of 1994. Understand? So Stellar and et al. It is they have formulated this model as evident. Okay. So here it is this model is raise the awareness about the importance of applying research findings into the nursing practice. So it helps us to give awareness of the importance of research findings that has to be implemented in the nursing practice. Okay, so this evidence, it is based on the 2 kind of resources or sources. The first one is external evidence and other one is internal evidence. So external evidence, it is derived from the opinions of the concepts, or it is derived from the expert's own experience. Okay, so opinions of the concepts means we are having some pre-concepts in our mind. If you are doing like this, it will come out like that. So and then the next one is expert's own experience. So as a clinical expertise, I have a own experience with the patient care. If I give like this, the outcome will be like this. So that we call it as a external evidence. The next is a internal evidence. It is a systematically obtained fact at the ground level. So at the ground level itself, we are proven that as a systematically proven one, the evidence that is called as a internal evidence or inside one. Okay, so when you come to this stellar model, it has a 5 phases of this achievement. Here we are having a 5 phases. Phase 1 is a preparation phase, and then phase 2 is a validation, phase 3 is a comparative evaluation decision making, phase 3 is a translation, application and evaluation. The phase 1 is we are preparing a kind of a steps in a nursing care or evident care, and then the phase 2 is validation. So what kind of interventions we have given to the patient, whether it is good or not, that we are validating in a phase 2. In a phase 3, comparative evaluation decision making. So we are having alternative plan also. We are having a comparative of that, and then we are taking a decision maker of it, and then translation the application. So which one is effective, that we are translating as application form, and then we are evaluating the intervention. So these phases which is having in a stellar model. So stellar model, which is formulated by the Stellar in the year of 1994, it is called it as a practitioner model. So it is indicate or it is implicate that all the research finding has to be into the nursing practice. It has a two forms of sources, that is a external evidence and internal evidence. External evidence, which is derived from the opinions of the concepts, and then it is derived from the experience of the clinical expertise. The internal format is the systematically obtained fact at the ground level of evidence. Okay. The next model is Lohwa model. It is formulated in the year of 1994. So in this model, insists that they infuse the nursing research into the practice. So what are the nursing research which is done by the nursing practitioner, nursing expertise, it has to be into the nursing practice in every day. And then it is use the all the multidisciplinary approaches into the nursing practice. So this is the benefit of the model. So when you come to the highlight of this model, it is incorporate the use of research and other form of research. So this kind of research and other form of research, it is incorporate into it, and it is make as a practice. The other thing, so research use, it is used at the every level of organization, at the down level to the at the top level, all the level of organizations, they are using the researches, and then it is linked in the quality assurance. So if you use like this, it will become. So like the quality assurance, it will be coming. It will be highlight of this model and explain how the organization will be changed. It is based on the research. So if I found out outcome like this, so the organization also need to be changed according to the outcome. So need to be change their practice according to achieve the particular outcome. And then it gives you the systemic design of a approach. So this is the highlight of Lohwa model. When you come to as a me, so this Lohwa model is more effective in evidence-based practice, but it has some barriers in a nursing practice, that is a problem-focused triggers. Problem-focused triggers is risk management data. So here the process of implement of data externally and then internally benchmarking data. So it provide one benchmark it may cause a nursing professional to push towards the particular benchmark. So basically, it is very risk of a nursing practitioner to achieve the particular benchmark. Okay, and then next is a financiary data. It is the identifying a particular problem, and it will take a time to identify the problem. It may long way to go to achieve that, so that it is a problem focus triggers. Okay, next is a knowledge focus triggers here. So there is upcoming of a new researchers and the national policies, and then guidelines from the national sectors or from the institutional sectors. So it also trigger, or it also one of the barrier to use in the nursing practice. The next is questions from the institutional standard committee. So here I have told you that it has a benchmark. So if questions which is arise from the standard committee of the particular hospital or organization, why you doesn't able to achieve the particular benchmark, so that also one kind of a barrier to use this LAVA model. So the LAVA model, it is formulated in the year of 1994. So it does mainly infuse the nurse research into the nursing practice, and it will be approach, or it will be implement all the multidisciplinary approach into the practice. So highlights of this is it incorporate use of a research, the other form of the research, and it can use in the every level of organization, and it will be linked in a quality assurance, and the organization how it explain how the organization can change based on the research, and then it gives the systemic design. So here also we are having a barriers in a using a nursing practice. That is a two kind of a barriers. That is a problem focus triggers and the knowledge focus. What model is Rosenbaum and Lowry model. It is formulated in the year of 1994, formulated by the Rosenbaum and Laura et al. So it is based on the theoretical part and the research literatures. Okay, so the assessment, it is need an integration between the knowledge as well as between the literature knowledge of evidence based on the protocol. So here we are having a stages. There is assessment need to be changed, and that may leads to the link the problem, and then interventions and then outcomes, link the problem, interventions and then outcomes, and then synthesize the best evidence. First they assess the need, why it need to change, and then link the problem, interventions and outcome, and then synthesize the best evidence. From this we have synthesizing the best evidence, and then design the practice change. We are formulating one kind of a change of practice, and then implement that and evaluation changes in the practice, and that is integrate the and manage in the practice, or maintain the changes in the practice. So here first we are doing the assessment, why the change is needed, and we are linking the problem, interventions and outcome, and we are synthesizing the new evidence and design the practice change, and then we are implementing and evaluating the changes in the practice, and integrating and maintenance the changes in the practice. So this is the stages of Rosenbaum-Lawrence model 1998. So it is mainly based on the theoretical evidence, and it is research literatures. It is need the integration of the evidence based protocol. First we are doing the assessment, then we are doing the problem, interventions and outcome, then we are synthesize the best evidence, and then design the practice changes, and implement the evaluation which is changes in the practice, and integrating the maintain the changes in the practice. Okay, so we have seen the three type of a model: Stellar model, Lava model, and then Rosenbaum and Lowry models, which is based on the evidence based practice. So next we move on to the barrier in evidence based practice in nursing. So here there is a lack of value of research and the practice. So they doesn't have a knowledge regarding the research, why the research is needed in a nursing practice. and then difficulty in bringing changes. We are came with one kind of outcome, but the institution which is not ready to implement the particular outcome into it. And the lack of administrative support. All the nurses are facing like that only. So if you are with the one solution, or if you are with the one findings, the institutions which is not support us to implement the particular solution. And then lack of time frame, and then complexity of the research reports, then lack of knowledge about the evidence-based practice. Nowadays also, even though if you are in a newer era of nursing also, all the nurses doesn't have a knowledge about the evidence-based practice. The lack of knowledge to all the nursing professionals, so it also have one barriers of a evidence-based practice. And then organization which is failed to monitor or fail to reward the nurse practitioner or nurse researchers who come with a new kind of outcomes. So these are all the barriers which is present in the evidence-based practice. When you come to the advantages, it is help us to provide a better outcome of a patient, and then it is help us to increase the efficiency of a nursing care, and it is help us to make a decision based on the knowledge, and it is make all the nurses, all the nursing personnel make us or keep us nursing practice in a current and relevant to the newer trend. And then it is help us to give a high quality and cost effective nursing care or nursing interventions. This is the advantage of evidence based practice. When you come to the disadvantages, the time frame, it is very time consuming process, and then it is there is no enough evidence which is based on the evidence-based practice. That is one kind of a disadvantage for us. And also it is a as a professional nurse, we cannot able to provide a judgmental in the evidence-based practice, decreased in the professional judgment, and then it is suppress our creativity. So we have to follow the kind of a time frame or a kind of a framework, and then it is a we have to implement with the influences with the all the legal proceedings, so it will take a time and it will consuming our work and everything. And then there is a publication bias. So these are all the disadvantage of a evidence-based practice. Okay, dear ones, till now we have discussed about the evidence-based practice. So nowadays this evidence-based practice very important in as a nursing professionals. We have to know about what is the evidence-based practice, why it is needed in a nursing, so how it does help us to improve the efficiency of a nursing care towards the patient. Hope you understand this topic. I am very happy to share a little knowledge related to evidence-based practice to you. We will be see you in a next video if it is possible, as soon as possible. Thank you.